Hello, my name is Dr. Wayne Rosenkrantz. I am a board certified veterinary dermatologist. I practice at the Animal Dermatology Group in Tustin, California, and I wanted to run through some of the advantages of next generation sequencing, talk to you specifically about some case reports where we utilize this diagnostic test to help us isolate infectious organisms. I do want to disclose that I am an advisory member of the board of MiDOG Animal Diagnostics in Tustin, California. So I want to make sure we get that disclosure out of the way. So what I want to talk about in this brief discussion today is the importance of an accurate diagnosis and pathogen identification. By knowing the exact pathogen that we're dealing with, we have an appropriate diagnostic answer, and that leads to the correct therapy options. We have been frustrated over the years with no growth issues, particularly when we're trying to identify some of the more unusual or rare pathogens. And I want to show you the benefits of this, at least in identification, in a couple of case reports today. So, as emphasized, successful treatment of microbial infections begins with an accurate identification of the pathogen. And there are lots of tough examples of infectious organisms that we deal with. Luckily, not on a day in and day out basis, but many of these bacterial and fungal pathogens can be tough to identify. And even more importantly, some of these unusual pathogens also increase our risk for zoonotic infections. So this becomes of added importance in that not only can they be tough to diagnose in an animal, but they still run the risk of being a zoonotic pathogen that could pass from an animal to a human. And so that adds extra concern when we're talking about some of these unknown, more rare infectious organisms. The AVMA has reported anywhere between 10 to 30% of culture tests return with no growth or sterile. And so obviously, are we missing some of these infectious conditions? And, even in situations where we identify pathogens, say with routine cultures and sensitivities, we may be misidentifying pathogens, which we'll show you in a couple of examples in the case reports as well. So our first case is Lily. Lily is a 2-year-old female spayed German Shepherd that had presented with a history of weight loss, muscle cachexia, reduced activity. As far as dermatological lesions, these were open hemorrhagic to purulent lesions that were seen in conjunction with lower limb lymphedema or swelling. And Lily also had widespread lymphadenopathy. So in a clinical presentation, we were worried about neoplastic conditions such as lymphoma, lymphosarcoma, and then some other oddball infectious condition. Lily came with the history from a primary vet in the area with a previous culture of a methicillin-resistant Staph pseudintermedius and had been on antibiotics based on that report. At our clinic, these are the visible lesions that we're seeing with Lily. You can see in the first lower image here on the left-hand side, the marked cachexia and weight loss. Next image shows some of the lymphedema and swelling to the lower legs. And then we have evidence of this purulent hemorrhagic discharge occurring from the leg and the digit as well. She's a young dog and a white sort of German Shepherd cross. We decided we would do skin scrapes because there are higher incidence of dermatitis, but that was negative. We did some cytology from the purulent discharge that showed pyogranulomatous inflammation. And then because the lymph nodes were so prominent and on abdominal palpation, we thought we felt some kind of nodular lesions in the abdomen. We decided not only to do a lymph node aspirate, but an abdominal ultrasound. And we selected MiDOG next generation sequencing as our culture diagnostic test because this just didn't fit with a traditional methicillin-resistant staph infection. So this is the lymph node aspirate, and it's a very thick aspirate smear, but even though it is thick, you can see that there's some background hemorrhage, and there's evidence of what appears to be macrophages. But in addition to that, there seems to be some encapsulated infectious organism and some with even what appear to be budding hyphal-like structures. So our suspicion of some type of a atypical fungal infection was very high based on this. The abdominal ultrasound, showed some hyper and hypoechoic densities in the liver, and then also some enlarged mesenteric lymph nodes as well. So, we've got some further information, from our initial diagnostics, but we don't necessarily have an answer. And this doesn't fit with a methicillin-resistant staph pseudointermedius infection. We didn't really even see any coccoid bacteria, on the aspirates. So, the next generation sequencing is what we are banking on to give us some additional insight to the infectious organisms that we're seeing, at least suspicious of on cytology. So this is our diagnostic test here, and one of the things that's quite nice about the next generation sequencing done by MiDOG is it does give us, both commensal organisms as well as infectious agents, and it lists bacterial and fungal or yeast organisms as well. You can see number one bacteria that's listed here, a micrococcus, which is considered a normal commensal organism. And this is based on large database that they're able to determine this from normal and affected clinically ill dogs. But then most significantly, what fits really quite well with our aspirates is the presence of a fungal organism, and one that is very uncommonly found in dogs, and that's Acremonium borodinense. And this particular species has really been rarely, if ever, reported in dogs. It's been reported in humans, but it is a rare species or pathogen that's been seen. So by knowing what we have, then we can at least search the literature about other reports and cases. And this particular species, the Acremonium borodinense, is a rare, like I said, if rarely reported in humans and not reported in dogs. The most common seen in dogs is, or rather in humans, is Acremonium chollensiae. And this is an opportunistic soil fungus. In humans, it can create ocular and nail and cutaneous mycotomas. And again, it has been reported in dogs, and there's a list of some of the reports on the lower left here. Most of these cases, even in humans, are seen more in immune-compromised patients. And treatment for this often requires fairly potent antifungals, some of which can have their own set of side effects that can be potentially more disastrous than the disease itself. If you looked in the literature, there are some case reports of dogs responding to itraconazole, terbinafine, and even some of the newer antifungals like voriconazole. So we did try Lily on 3 weeks of itraconazole at high dose. So that's double the traditional dosing at 10 mg per kg BID. No real response, unfortunately. And then we tried voriconazole for a couple of weeks, and Lily was continuing to deteriorate, and unfortunately was humanely euthanized because of the lack of response. And although the outcome of this case is not, the best we would like to see, we did get an answer, and we did have an explanation for Lily's deterioration. I think because of the widespread metastatic and we say visceral organ involvement, likely probably had lesions in the lungs as well. That would explain the deterioration, and starting at such a late date with a diagnostic answer probably didn't put us in the best place. Which could also speak highly if we were to consider maybe running a next generation sequencing like MiDOG earlier in the course of the disease. Maybe we would have had a different outcome. So Cooper's our next case, and Cooper, we actually had previously published Cooper in the Veterinary Dermatology Journal. And so this will be a little quicker summary, but Cooper had a history of autoimmune hemolytic anemia. He had a non-healing wound on his leg, as you can see on the back of the paw. It was originally cultured and identified as a Pseudomonas species, but through the combination of MiDOG next generation sequencing, and then we actually confirmed this on PCR. We identified a new species of Burkholderia in this particular dog, Burkholderia gladioli. And this particular dog was on immunosuppressive therapy for the autoimmune hemolytic anemia, and that likely explained the opportunistic infection. But also, we did have a better outcome on Cooper than we did with Lily. And a Cooper, we submitted and had macerated tissue samples at the same time that we performed next generation sequencing. And you can see the local lab isolated a Pseudomonas-like species. And you can partially understand this to some degree because Burkholderia initially was thought to be a derivative of Pseudomonas. But when we ultimately ended up performing next generation sequencing, we were able to get the diagnosis of Burkholderia gladioli, and we had a very, very high count. And you can see again here, our bacterial count, 99.8%, came out with this particular species. And then we had a small amount of normal commensal bacteria that was also isolated. So in this situation with Cooper, we were lucky enough to kind of catch things early, and we were also able to reduce the immune suppressive therapy, which helped the patient fight the infection more appropriately. And then we monitored for relapses of the hemolytic anemia. So over a period of 6 weeks, we tapered the immunosuppressive drugs, and then we treated with marbofloxacin, which is a proven antimicrobial from the literature for Burkholderia. And then we got this very nice clinical response, and then lesions resolved, and we ended up doing quite well with Cooper long term, and he lived a nice ripe old age from, and fortunately didn't succumb like we saw with Lily in the previous case. So to kind of summarize just these brief points, I think next generation sequencing really offers excellent pathogen identification. It can identify multiple types of infectious organisms, strict and facultative anaerobic bacteria, slow-growing bacteria like things like Mycobacterium, gram-positive bugs, novel or rare pathogens, all fungi, and again, the aids in these unusual infections, particularly those that may present with the possibility of zoonotic potential. And for other additional benefits, resistant gene detection, understand that we're up to around 6,000 resistant genes that are available to be tested for in the database. And I like particularly that it gives us a breakdown of pathogens and commensals and gives us percentages of the pathogens. That's particularly valuable. And then it works in biofilm cases, and I understand that we have being documented to be effective in over 500 different types of biofilm backgrounds, which can be very difficult with traditional cultures. You have a really hard time identifying infections that are embedded in biofilms. So next generation sequencing, helps to solve that mystery of no growth, and hopefully you'll hear some additional presentations from the MiDOG diagnostic labs on their website as well. Thank you.